record. Thanks so much for your participation as we have had some Zoom updates. I think we're just experiencing some challenges. So thanks for being with us today. We have a number of upcoming events for y'all in terms of health screenings, wellness classes, and programs. And so if y'all would like to take a quick screenshot of this, that would be great. We have a screening tomorrow at Coleman Coliseum, and I will actually get to be with y'all tomorrow. So you will see me and my students at Coleman and at the Gorgas Library on June 9th, and then again at Russell Hall on June 29th. We have some upcoming classes, Nutrition for Exercise Performance, Clean Living Lifestyle, which I'll be teaching this year in 2 parts, and then a Strength and Mobility class that will be taught by one of our campus experts. We also have a Move Spring Challenge and some other wonderful things going on with the Rec Center. So definitely check those out if you're interested. And we will get started with our Safety in the Sun. And so my name is Abby Horton. I'm a registered nurse and I teach at the Capstone College of Nursing at the University of Alabama. So excited to be with y'all. I am a certified health and life coach. I am a Wellbeing ambassador and wellness class educator. And my contact information is here for you. It's abby.horton@ua.edu. So our goals today are to talk about sun safety, to introduce the importance of protecting your body while exposed to the sun, and to learn specific strategies to help you practice sun safety. So our disclaimer is that this is for educational purposes only. We want you to focus on what you can control, take what really resonates with you and feels like that's helpful for you, and just really leave the rest, because otherwise it can be overwhelming when you're in a class with this much information. And we always like to say that baby steps, small progress is still progress. So reach out if you do have any questions, and thank you again for being here and for being patient with our technical difficulties. So I think it's so important that we really approach any topic, especially a topic like this, where we're going to be talking about skin cancer and risk of being in the sun and different things that if you've come to my other talks on, mental wellness and work-life balance and stress and coping, those classes to me are a little less medical and a little more fun. And I really think that we should approach all of these topics with just kind of an attitude of, embracing it and not letting us be kind of in a fear-based mindset. Hey, Miranda, I saw your message. It is recording. I don't know if you can't see it on your end, but it is. And so I'm walking in sunshine. If y'all can think of that video or that song and just imagine, kind of the lightheartedness of that song and that spirit that you have, I hope that you feel that way, like you're walking on sunshine as we go through this presentation, even though sometimes, when we have different, challenges like we've had today, it's just a good reminder that, not to take things too seriously, even though it is serious and it's important, but it's important to have a little bit of levity and lightheartedness when we're talking about harder topics. So we will get started with that. This is a video. We're going to try to show it. Hopefully the technical glitches don't impair us from that, but there is no sound on this video. So it's just something for you to watch and read the words. All right, so hopefully that was informative for you. I think that's just a good introduction for what we're talking about today. And I want people to really befriend the sun. I love the sun. The sun has a lot of healing powers and properties. It's important for us to be able to get adequate sunshine. And so spending time outside is a great way to do that, to be physically active, to reduce our stress, and to get vitamin D. And we talk about vitamin D as if it's actually a vitamin that we should take. And really, it is a hormone process. So it is the synthesis of hormones, and our bodies at every cellular level need vitamin D to be able to complete that hormone cascade. And so we won't get too medical in there, but it is better for us to get vitamin D through sun exposure and only supplement when we absolutely need to. I personally need to supplement with vitamin D because I have some things that make me more at risk for not having enough, even in the sun. And so I'm not saying that we shouldn't have vitamin D as a supplement, but it's always better to get the real thing. If we can eat it, if we can consume it, if we can expose ourselves to it in the natural way, it's always better to do that and then supplement where we need to. So you can work and play outside without raising your skin cancer risk by protecting your skin from the sun. And I want you to really feel empowered and encouraged to be able to go outdoors and enjoy it without being concerned or overly worried about your skin cancer risk by doing some of the things that we're going to recommend today. So most skin cancers are caused by exposure to ultraviolet light, and we sometimes talk about them as being UAV or UVA, actual rays of light. And so it's an invisible radiation that you can get from the sun, but also from things like tanning beds and sun lamps. And that UV exposure actually damages your skin cells. And so it's important to just have an awareness. So UV light with the protection, it's really something that we think about during the summer months. And it's not something that we think about the rest of the year. Usually in the fall and the winter and the spring, we don't think about it as much. And so we need to think about protecting our skin all year long, not just during the summertime. May is Melanoma Awareness Month, and so that's why we've got this scheduled. It's also when in Alabama we start spending more time outdoors, and when the sun starts getting to be very close, where we feel a lot of those humid temperatures and hot temperatures. And so something to think about, but particularly we need to kind of shift our mindset around just the exposures that we have to the sun. A question I got in the Q&A box is, are we getting vitamin D with sunscreen applied? If you're applying enough sunscreen to protect yourself from ultraviolet light, you are likely not getting that much vitamin D exposure. So not enough for you to meet your daily requirements. And so a little later in the presentation, I recommend that before 10 a.m. you get outside and get 15 to 30 minutes of sun in the morning. And it's important to do that where you're having skin exposed. So like I have a long sleeve shirt on today, so I would need to wear something that had my arms and legs exposed. I also would want to do this without sunscreen before 10 a.m., which is when the sun and the UV light starts to get stronger. And then you would also want to not have your sunglasses on. Of course, you don't want to have direct sunlight exposure to your eyes. But if you're in indirect sun, then you could have your sunglasses off, and that really helps reset your circadian rhythms. We really rely on actually having sunlight exposure to be able to make sure that we can actually get that reset. So hopefully that helps, but we'll talk a little bit more. I'm going to go ahead and mark that question. Okay, so UV rays can also reach you on cloudy or cool days. And so the sunlight, the UV light actually reflects all things like water, cement, sand, snow, especially lighter colored objects in our environment. And so when we're at the beach or when we're at the lake or we're doing things outside, even in the sand and the snow, it's important that we think about the reflectivity of the light, because that will cause us to get more sun exposure and we can burn quicker. And so I have a reminder at the end of the presentation about that as well. So in the continental US, UV rays tend to be strongest between 10 a.m. and 4 p.m. So this might change a little bit depending on where you are in the time zone, but 10 to 4 is usually the recommendation that you're, protecting your skin with sunscreen, that you're wearing protective clothing, maybe that you have a wide brim hat that you wear, that you have your sunglasses on if you're outdoors or if you're driving and you're getting a lot of light. So those are things to consider. The forecast of the strength of the UV rays is something that you can actually look up. I think that probably most of us aren't aware of that, or most of us don't actually think about it. You can see it in a weather report, but you also have various news outlets that give you the UV index for the day. And so if your index rating for your area is 3 or higher, then you need to make sure that you're taking extra precautions to protect your skin, because the UV rays are going to be stronger that day and during those hours where it's marked above a 3. And so I'll show you that index a little bit later. I'll also put lots of beach pictures here. I feel like we all could probably use a beach day, and so hopefully you'll get a little bit of nice visuals while we're talking about this. So the difference between UVA and UVB rays is really about the depth at which they interact with your skin. And so UVA rays can penetrate deep into the layers of your skin, and it tends to be the rays and exposure that causes that premature aging and fine lines and wrinkles. And so that's something that you want to think about when you're getting sunscreen, that you're actually getting a broad spectrum sunscreen that's going to protect against both UVA and UVB. Some sunscreens actually don't protect against both. UVB rays are going to be those that are primarily the result of sunburn, and that's penetrating the outer layer of your skin and causing damage to your skin cells. So too much of either of these is going to cause premature aging, sunburns, and these are things that you can be exposed to even on cloudy days. So about 80% of the sun's UVA rays actually pass through the clouds, and so even on cloudy days, you still need to be wearing sunscreen. Tanning beds, it's really important that you avoid tanning beds because they are not safer. When they first came out and became very popular in the 90s and the 2000s, people actually touted tanning beds as being the safer option. And we know through research today that that is not the case. And so you definitely want to avoid tanning beds, or I don't think most people use tanning lamps, but those are things that you want to avoid. Those primarily use the UVA lights and rays, and so those are going to be penetrating deep into your skin, causing long-term skin damage and fine lines and wrinkles. And most people who are tanning are probably tanning because they're concerned about, beauty and aesthetics. And so really in our quest for a good tan, we may be actually causing more issues in terms of skin wrinkles and damage and sunspots and uneven skin. And certainly you still can really put yourself at risk for cancers with both of these types of rays. So both lead to increased cancer risk. So very important to remember that. And UVA and UVB is here illustrated in terms of the epidermis is going to be that top layer of skin that you have. And then the dermis is going to be that next layer of skin. And then you've got the hypodermis, which is going to be that deeper layer of skin. So you've got, if you looked at a cross section of our skin, you've got those 3 layers at the very top. And so UVB, where we burn, where we're outdoors, we're getting that top layer, of epidermis kind of damaged, although it can go deeper if we've got 2nd and 3rd degree burns, which can happen just from sun exposure. And then you've got UVA, which is going to go to those deepest levels of our skin layer. So that's just a visual image for y'all to see. I think so many people hear UVA and UVB, but don't really understand the difference. And so I wanted to be sure to introduce that to y'all if that was a new concept. So this is the index that actually looks at, a 3 rating or higher. So essentially a 1 to 2 rating is going to be the only time where you would really be okay to not have protection. Above the 3, you're going to want to actually do some things to protect your skin and your eyes. That's very important. So steps towards sun safety, always try to find the shade. So when you're outside, whether you're at the lake or the pool or the beach, or maybe you're just doing yard work, or maybe you're watching ball games. I know ball games are in full swing for many of us. Make sure that you know where there's, some covering, whether it's a tree, an umbrella, a beach umbrella, a tent, just a shaded area. Maybe there's an awning or something. Always look for the shade because you might need to actually take some breaks. usually once an hour is what I suggest, especially for people who are vulnerable for some reason. Maybe they have different medical conditions. Maybe they've got young children. Maybe they're older, or just, have a sensitivity to the sun. We also have to think about people who are photosensitive because of medications that they take. And so definitely look for the shade. Wear long sleeve clothing and protective clothing when you can. So things like, beach or pool cover ups when you're, on the water. If you're at the lake, having a cover up is really helpful. Having some of those, skin guards that you wear that are long sleeve and high necked can be really important, especially for children. When we have sunburn in childhood, the more sunburns we have, the more we increase our risk for skin cancer later in life, in adulthood. And so when we have 5 total sunburns, we've increased our risk for skin cancer. And I'll talk a little bit more about that. And I can tell you, as someone who loves the sun and loves being outdoors, it was not uncommon for me to have 5 pretty severe sunburns just in one summer. And so I definitely have increased my personal risk. So I'm talking to you from a place of experience personally, not just professionally. So clothing, again, you can get things that have SPF, but lighter clothes usually are going to be more reflective of the sun, and just darker colors may offer more protection. It just depends. I know sometimes we think that the darker colors actually pull the light in. We feel warmer in the darker colors, and so we do tend to gravitate toward lighter colors. But really the best bet for you is to try to find clothing actually has SPF protection built in. And I'll offer a couple of companies that have some of those options. They are pretty pricey, but it's important if you're going to be outdoors a lot that you have some of those things, especially like a wide brim hat that has that extra protection. So a hat is really important. We sometimes see people wearing a lot of baseball caps when they're outside, and that doesn't offer quite enough protection on your face, especially your nose. That's going to be, because it's the most prominent thing on your face, it's going to be the thing that probably burns the fastest, but also the tops of your ears. So right here on the tops of your ears is a really common place for you to get skin cancers or to get sunburn. You also can get sunburn on your eyelids. I recently saw a friend who had sunburn because they had laid out and they didn't have any sunglasses on, and their eyelids were actually puffy and swollen and red. And that can actually cause eye damage. And so it's important that you're, staying aware of that. I have burned my eyelids before on a beach trip, and that was one of the most painful experiences. So that's something we don't often think about, but make sure that you're actually paying attention. And we sometimes tell people to avoid putting sunscreen near their eyes because it can, with sweat and just being outdoors, it can kind of get into your eyes, which is going to burn and be uncomfortable. So your eyelids and eyes are particularly important to protect with other things like sunglasses and hats. You also want to make sure that the back of your neck is staying covered. So you may want to get a hat that either has enough coverage in the back or maybe has one of the little cloth flaps that goes over your neck, particularly if you're going to be outside and working, if you're going to be bending over, that sort of thing. Sunglasses, again, are so important, not only because it protects your vision, but also because you have a risk of cataracts that develop with sun exposure. And so that's an important component. Most sunglasses in the US do protect 100% against UVA and UVB rays, but you want to make sure that that's true. And so you're usually able to look at that. There's usually a tag or there's something on the glasses that will indicate that they protect against both. And it is good to think about having glasses. These do not wrap around, but it's a good idea to think about glasses that do have that side protection, because you can get a lot of glare from the side of your eyes and you can actually still get sun exposure that way. So if you're going to be outdoors, you might want to think about that. For sunscreen, you want to use that broad spectrum. Like I mentioned, broad spectrum just means that it protects against UVA and UVB. And you want to make sure that you're using about an ounce for each time that you apply your sunscreen. And most people probably either underuse the sunscreen or overuse it. I think it's a little bit tricky sometimes to know exactly how much you need. You don't want it to be so thick that your skin is visibly white. And so you want to make sure that you're actually rubbing in the sunscreen. I know some people are concerned that if they rub it in too much, then it's not protecting your skin. But there's a fine balance. Just like you would rub in any lotion, you want to try to achieve that level where you still see that your skin is pretty dewy, but that it's not, a thick white layer that you sometimes see with young kids, moms slathering their kids and not getting to rub it in. So definitely think about that. Think about putting it on the backs of your hands, the backs of your, neck and shoulders. Those are places that we sometimes forget to actually use the sunscreen, or maybe we end up wiping it off just because of the way that we're using it. Sunscreen is actually not recommended for babies under 6 months old, and babies are actually recommended to not be out in the sun, particularly at midday, that 10 to 4 p.m. range. So there's some definitely, recommendations for FDA according to the infants really should just be in protective clothing and not out in the sun. You can get glasses for children, but usually hats are a little bit easier to get kids to wear sometimes than sunglasses. So just do the best you can with that. With SPF, you want to make sure that you're wearing at least SPF 15 or higher. And you want to make sure that when you're applying it, that you're applying it 15 to 30 minutes before you're going to be outdoors. 15 minutes if you're just going to be outside, but closer to 30 if you're going to be in water. And then the sunscreen is going to wear off quicker as you're swimming and sweating and, toweling off and things like that. So make sure that you're reapplying after you get out of the water, or at least every 2 hours. And definitely check your expiration dates. I know sometimes we get a bottle of sunscreen at the end of summer and we don't finish it, so we use it the next year. And that's usually okay, depending on the type of sunscreen. The cleaner, and I mean clean as in the less chemicals and additives and things that your sunscreen has, the more likely that it's going to expire quicker. So you always want to just test it. And if you're going to have a long, like Memorial Day, outside, or a beach day or a lake day or something like that, or you're just going to be outdoors without a break, I would definitely recommend using your new bottle of sunscreen for those days, and maybe your older bottle on the days where maybe you're just going to be out for a couple of hours watching a ball game or something. You don't want to test the effectiveness of your older sunscreen on one of those long, full beach lake days. So more about sunscreen. Like I said, 1 ounce of sunscreen to cover your bodies for each application for adults. Apply sunscreen to all areas that clothing will not cover, but you also may want to apply sunscreen to sensitive areas if you have thin clothing on, because you can still get burned through your clothing. Like I said, 15 to 30 minutes for applications before you go outside, just to make sure that it gets time to dry. Don't forget your lips, because you can get blisters and sunburns on your lips, and that's not fun. They will tend to swell like your eyelids and makes it very painful to eat. So I like to tell people to avoid the aerosols. Anytime you're spraying the sunscreen, you're also inhaling it, and people really have sensitivity to that, some more than others, but it's just not good for your lungs. And it's not good for your airway and just breathing. And so I am personally not a fan of aerosols, but sometimes moms feel like that's all you can get on your kids because they won't stand still. And I definitely used them on my kids when they were little. But just as I've learned, and had more experiences, I think aerosols are just not the best. They're not ideal. Maybe try the sticks on the kids. You can get sunscreen sticks. You also can get sunscreen powders. So those are things that may make it more fun for kids, because sometimes kids just don't like the sticky texture of sunscreen. And sometimes adults don't either. So those may be different options for you. Sun safety, here's some just visuals of things I've already mentioned. Again, drinking water, doing all of the things I mentioned. Most of these have already been talked about, but water is so important. We talk about, pre-hydrating before you have a big event or something like that. So make sure that you're drinking water before you go outside, because it's so difficult once you get dehydrated to get yourself caught up on the water that you need. So drinking, a couple of glasses of water before you go outside for your Memorial Day, or before you go to the pool or lake or beach, or just, outside, enjoying the outdoors, make sure that you're actually drinking some good water. And you also want to remember that when you're driving, you don't think about this. I didn't think about this until I became a nurse, but a lot of times, even if you don't put your arm in the window, does anyone do that where you put your arm and you're laying it across, the armrest on your door, or you're laying it across the window? My husband does that a lot. You're getting more sun when you're driving on the left side of your body and the left side of your face. And so sometimes we will see more skin cancers in those two areas. So make sure that if you're driving for long periods of time, especially if you're taking like road trips or something, that you're mindful of your sun exposure in your car, because you definitely, if you're sensitive for sure, can see some issues there. And I just think that's unique to point out things that we often don't think about. Same thing goes for your right side if you're, mostly the passenger, but probably most of us are the driver primarily. So take 5-minute showers or less. This might be hard for some of you. It's hard for me. I like a good shower, or, sometimes if you take a bath, if you soak, you try not to let that be for long periods of time. Try to avoid hot water, because the longer the shower, the hotter the water, the more the natural oils in your skin are going to be washed away. You also want to try to use a moisturizing lotion after you shower to hydrate your skin well. And of course, a cleaner brand would be great, because you don't want to have a lot of extra toxins and chemicals and additives in those products. Drinking about half your body weight in ounces a day is a really great idea to keep you from feeling like you're just getting, dehydrated. In our family, we say, we don't want to feel like we're jerky. We don't want to feel like we're being dehydrated from the inside out. And sometimes that's how it feels in the Alabama sun. So drinking about 128 ounces of water can be really helpful a day. That's about a gallon of water. And that's anything from 4 to 8 ounces. So 4 ounces is going to be closer to the 64 minimum recommendation of water intake a day. And the 8 ounces per hour is going to be closer to that 128 hours. And so 4 to 8 ounces per hour is a good recommendation for you to be drinking all the time, regardless of the sun. And so that's about half of your body weight in ounces per day, or up to 128 ounces. You can get water toxicity. So, too much of a good thing is not good. So you want to make sure that you're not overhydrating. And if your urine is clear or very pale yellow, you may be overhydrating. You want your urine to be a straw color, pale yellow color. But if it's super, super light and pale, or if it's clear, you're overhydrating and you're putting yourself at risk for an electrolyte imbalance. And so that's something to consider. I will tell you a disclaimer that I'm not a fan of Gatorades and Powerades and different sports drinks like that, because of the added chemicals and just the added sugars. It's something that you definitely can use, but there are better options in terms of electrolyte drinks for people. And so now, if I'm super dehydrated and all I have is a blue Gatorade, then that's my favorite and I'll drink it. But it's not something that I would recommend you doing on a regular basis. So skin cancer risk, 1 in 5 Americans, unfortunately, will develop skin cancer in their lifetime. Tanning bed use before age 35 increases your risk of cancer by 75%. And I definitely am raising my hand on that one. I would tan in high school and in college and right after college a good bit. And so I understand, that that's something that people really enjoy. I did at that time in my life. And so no shame there. It's just when we know better, we can do better. And people who use tanning beds are usually about 2.5 times more likely to develop squamous cell carcinoma, which is one of the 3 primary types of cancer. And then, like I said, your risk of skin cancer doubles if you've had 5 or more sunburns in your lifetime. So if you've ever had 5 total, even if that was, 20 years ago and you were in your childhood or teen years or early adult years, you still have doubled your risk of skin cancer. And just as a disclaimer, because sometimes it can feel like we're being talked to in these classes when we're learning stuff, and there can be some shame and guilt around, oh goodness, I did this or I did that. I've done all of the things that I've told you today are not good things to do, because I do love the sun. I do love being outdoors. And I've had to make some changes because I've had precancerous cells. I've had cancerous moles. And so I've had to make some changes. So just know that we're talking about this from a place of grace and not judgment. So skin cancer facts. About 90% of pediatric melanoma cases actually occur in girls ages 10 to 19, because that's the time where usually kids are still outdoors, and particularly young girls like to have a tan. That's just culturally acceptable. And so that is something to be aware of. We don't think about children having melanoma usually, but it's on the rise. 1 American dies every hour from melanoma, and the most common cancer, not the most common skin cancer, but the most common cancer among women ages 25 to 29 is melanoma. And so it takes about 28 days for our skin cells to regrow and to regenerate. And so that's important as you're trying to think about, if you're concerned about your skin or skin damage, there are definitely things that you can do. 28 days is not a long time, which is great, because that means that a month from now, if you start to make changes with how much water you're drinking, your sun exposure, et cetera, then you can really start to see an improvement in just under a month. There are 2 million non-melanoma cases of cancer diagnosed every year. So those are the other types of skin cancer, and that does not account for the melanoma cases, unfortunately. I did want y'all to just see this image. This is a type of graph that we would use in nursing school to teach you about your skin cancer risk and what the appearance looks like. And so this is considered basal cell carcinoma. This is squamous cell carcinoma. And I always say that it kind of looks like a little bit of sugar is on the raised area. So it almost looks like the base is the same. It's just a little redder, but there's some crustiness that almost looks like some caramelized sugar on top, and it can feel that way too. And so that is one of the things that is kind of indicative. And then this is melanoma. And my disclaimer on this is melanoma after it's really advanced. Melanoma can look, much less kind of stark and intimidating than this. And so I don't want you to think that the only time that melanoma is detectable is when it's this kind of stark and this dark and this ominous looking. It can be much more subtle than that. So in textbook world, we always pick, the most, kind of exaggerated version so that you really can recognize it. But just know that this could be much lighter in color, smaller, and could look, much less benign than it is. So maybe this is helpful for y'all when you're starting to look at your skin. I'm going to talk to you about doing skin checks. And so that's something that maybe that will be helpful as you look at your skin every month. These are melanoma places of risk that are higher in men versus women. This has to do with behavior. I know when we talk in statistics and research, we always use the gender binary of men and women. Sometimes it has to do with hormones. Sometimes it has to do with exposures and, behavioral risk factors, things like that. It's not always because it's genetic or that it has something to do with, being a female versus a male. Sometimes it's just behavioral risk factors and exposures. So we don't know enough to really understand why there's gender differences between the types of cancer here. There's a lot of speculation, but I did want to point it out just simply because if it helps one person find cancer, then I think it's worthy of mentioning. So women tend to have cancer on, and especially melanoma, on their legs and on their arms. And so those are going to be the places that you want to look. The backs of the legs, I really want you to pay attention to, because that's a very common area and it's hard for you to see, especially the upper leg. And that's a very common place for those to become kind of undetected unless you go in for a regular skin check with your doctor. So arms and legs for women, and then that's followed by the trunk. So that's going to be just kind of your core, from your shoulders to your waist. And then for men, it's usually going to be in the trunk and in the head area. And then next would be the arms. So trunk and head and neck. And head and neck is the most common, depending on the type of cancer. For melanoma, it's going to be the trunk for men, but it's very closely followed by the head and neck. So this is what you look for. We call these the ABCDEs of melanoma skin checks. So we want to look to see if there's asymmetry in your moles. And usually the melanoma, you're going to have had a mole in that area. That may not always be the case, but always look very closely at your moles. You may not think it's a mole, you may think it's a freckle, but just look at those areas, whether it's a mole or a freckle, look to see if you've noticed changes. So is it asymmetrical? Has the border changed, or is the border uneven? Do you have a different color? That's what most people notice, is that the color changes. So the color could be, one uniform color and then there's a spot in the middle. That doesn't mean it's melanoma, but it's something to kind of pay attention to, because if the color starts to change, that could be a sign that the mole is changing. The diameter, if it's larger than a pencil eraser. So I have a pencil right here. Let's see if I can get it in the camera. So if the mole is larger than that pencil eraser in terms of the diameter, then you may need to check that. Now, if all of your moles are that size, then that may not be a risk factor for you. Evolution or elevation. So has the mole changed, or is the mole elevated? When you run your finger across it, is the mole actually something you can feel? That matters. There's also a last letter, F, which we have started to say is F for funny looking. Does it just look different than your other moles? Does it look different than it looked like it did before? Has there been a change? Is there just something funny about it, just doesn't look right? Then you may need to have it checked. And so these are some things that you can use as a guideline as you're looking at your skin and as you're looking at your moles. Sun poisoning is really important to know about. You definitely can have a lot of complications from sun poisoning, and it looks like these blisters. And so there are a few more pictures that may not be, good for some people. I know sometimes people have weak stomachs, so hopefully this isn't bothering you. Just look away if it is. But sun blisters on your lips, on your limbs, and on your shoulders. I have gotten sun poisoning from the point of actually having these all over my back, and it is very, very difficult. You feel very nauseated, you get very cold, you feel very dehydrated. It's not pleasant. You almost feel like you have the flu, but it's from the sunburn. So that's very important to seek medical treatment if you do have these issues. And again, they may have to actually go in and do something about these larger blisters. They may have to actually pop those in a medical setting. You don't want to do that at home though. So keep your skin covered, keep the skin moist so that you can try to maintain the integrity of your skin as best you can, and always seek medical treatment if you start to see this type of presentation on your skin, because you're going to need some support. Some other things like heat exhaustion and heat rash are things that can occur. I do have a slide about the difference between heat exhaustion and heat stroke. And so I just wanted to put this in to give an idea. Heat rash is something that can develop because your skin rubs together. So there are things like aloe vera, calamine lotion, and different ointments that you can use. Sun poisoning is going to be, a variety of treatment options that need to be overseen by a healthcare provider. Minor sunburns can be, really painful and usually treated at home. But if you continue to feel, unwell, or you're not seeing an improvement, you're going to need to seek medical treatment. And then we'll talk more about heat exhaustion here. So heat exhaustion versus heat stroke. Of course, heat stroke is more serious and you need to call 911. But things I want you to think about as you look at this graphic, and Miranda can pop the slides in the chat, hopefully for us, so that you have access to this. But hydrate before you go outdoors, take shade breaks frequently, so at least once per hour. Thank you, Miranda. Pay attention to your body on humid, overcast, and breezy days, because those are the days that you're not probably paying as much attention and you think you can stay outside longer. Notice if you're sweating or perspiring, is that more or less than usual? Because if you're sweating more, you're probably trying to cool off. You're probably getting overheated. That's our body's natural response to getting too hot. If you're not sweating at all, that's not a good thing, because it means that your body isn't able to compensate. And so if you're not sweating, just in general, that's something you want to think about talking to your doctor or your provider about. But if you're outdoors and you're not sweating, you need to be thinking, I need to get in, I need to get cool, I need to get water. And one of the ways that you can cool off, we have got vessels in, several areas that are prominent at the skin surface, your neck, your underarms, kind of in your armpit area, and your wrist are all good places to be able to put some cool cloths, cool water. One of the best ways to cool off is to actually put both hands under a sink faucet, turn on the cold water, and put a cool rag on the back of your neck, and that will help cool off faster. Sometimes we get so dehydrated that we drink water and we feel like we're going to be nauseated or we're going to vomit. And so if you get to that point, that would probably be the time to grab your electrolyte drink, to grab your, Gatorade or something like that, because we can get so dehydrated that water makes us feel sick and upsets our stomach. And so that's when you want to really reach for those electrolytes and follow up with your healthcare provider. You need to be doing these things as you plan to go to your minor med or emergency room, depending on your symptoms. Don't forget to protect your eyes, ears, lips, nose, scalp, especially. There's some sunscreen that you can get that actually goes in your hair and the back of your neck. I mentioned your eyelids and eyes. BioTrue is one of my new favorites in terms of a lubrication for your eyes. I have dry eyes naturally, and I do a lot of computer work. So even when I'm not outdoors, I use these drops because they really do help. I've used a number of different brands, and this is my favorite by far. I think it just really does a great job. I mentioned about being outdoors in terms of sunscreen use. Photosensitivity, if you're taking heart medications or blood pressure medications and any number of other meds, you may need to look to see if they cause photosensitivity, because a lot of times the medicines you take, the way they're metabolized, can actually make you burn faster. And so people who are like on hydrochlorothiazide and lisinopril and meds like that for blood pressure usually have very low tolerance for being outdoors in the heat, and have very low tolerance for photosensitivity. Like they're going to get burned pretty quickly within probably 5 or 10 minutes of being outside. You also want to check your nail beds. So in your actual nail, if you see white or pitting in your toes or in your fingernails, the bottoms of your feet, and places that you don't actually see the sun. My cancerous and precancerous moles really kind of ironically have all been in places that have had the least amount of sun exposure. And so I know that sounds odd, and there's a lot of reasons for that, but just for the sake of today, just know that it's not always where you think that you're going to have the cancer. And so definitely look and make sure that you're checking all of those areas. We mentioned the reflectivity in the sun. So just remember, you may need more protection at different areas. Outside is not outside. You may need more protection at the lake, the beach, etc. Like I mentioned, create shade if there isn't shade with the umbrellas and tents. And just because sun safety, I also want to throw in water safety. The state of Alabama has the most fresh water bodies in the entire country, in the continental U.S. And so that's something we should really brag about. I don't know how many people know that, but we have the most fresh bodies of water. And so water safety is really important. And wearing bright colored SPF protective swimwear and cover-ups is so great in terms of, protecting your skin, but also protecting your safety, and just making sure that if you were to have a child that was lost in the water, or you were to become lost in the water for some reason, that they could easily spot your swimsuit. You can do a quick Google search and find out what colors are best. Hot pink and like a bright yellowy lime green, those kind of neon colors are going to be easier to see in all different shades of water. So that's something to think about. Special considerations for those who have darker skin tones. There are a lot of myths around if you're darker skin toned, you're at a less risk and you don't need to wear anything in terms of protective clothing or sunscreen. But you are at risk even if you do have darker skin tones, and it may be slightly less, but it's not dramatically less. And so unfortunately, those who are in those communities with darker skin, Hispanic folks, Black and African American people, Asian people, the people who have the less risk tend to have later stages diagnosed because they're not being screened properly. And that's something that we have to do a better job of in healthcare. And that's something that we have to do a better job of educating people. And so still, regardless of skin tone or coloring, you want to make sure that you're doing all of the preventative measures. And so For those folks, Asian, Hispanic, and African American populations, they are more likely to develop melanoma on the soles of their feet, like I mentioned, the palms of your hands, and in between the toes and fingers, and in the toes, the toenails and fingernails. And so those are going to be places that you want to look regardless of skin color, but particularly important for those folks. So see a dermatologist for an annual skin assessment. That's important. Do your regular checks at least once a month at home. So when you're doing your self-breast exam or self-testicular exam, also check your skin and get someone like this dermatologist. You may not have to look at it through a magnifying glass, but get someone to check your back and your legs and things, places that you can't see. And then also your scalp, because that's hard. So, do the same method you would do for looking for ticks, where you kind of move the hair out of the way. Look at the scalp and see if you have any areas of concern. Know your risk factors and provide that information to your healthcare providers. Have you used tanning beds? Have you had mole changes? Have you, used a lot of, sun tanning enhancers and things like that? Do you have a family history of cancer, of melanoma? That puts you at a greater risk. And then any previous diagnoses or concerns or environmental factors. Maybe you work outside a lot and that's not reflective of your paperwork that you submit when you go to the doctor. Bring that to the doctor's attention. And if you're seeing a dermatologist, certainly mention that to them. So those are all things to consider. Here are some products. Neutrogena 100 plus SPF is going to be probably the most recommended by dermatologists. My husband and I have both had skin cancers. My husband has had melanoma, and this is the one that his dermatologist recommends for him that he wears. There have been some recalls on sunscreen recently, and so do your research to see what's the best fit for you. None of them are perfect. This is a cleaner brand. It's one that I tend to use, but everyone in my family has to use a different sunscreen for different reasons. And so one size does not fit all. So test it out when you're only going to be outside for an hour or two, when you have the flexibility to come in. Try out different sunscreens and see what works the best. And it may be that you have to have a different sunscreen than your spouse, than your children, than your neighbor, and that's okay. Definitely not a one-fits-all approach there. The Think Dirty app has brands that they recommend. Just know that those are probably not going to be as long-lasting or as effective as some of the ones that have more chemicals and additives like the Neutrogena brand. And so you definitely want to use these with caution, but they are cleaner versions, and you can get the Think Dirty app for free. And actually be able to scan the barcode or do a search and see which brands you want to try. This is the Think Dirty app. And also the Environmental Working Group app has different ratings for how you can look for products. This is not just for sunscreen, it's any product or food. But these are two great sources if you're concerned about the clean options. Also for the environment, because what's cleaner and better for us is also cleaner and better for the environment. We have a lot of issues with coral reefs being really at risk because of the chemicals in the sunscreen getting into the water and impacting the plants and animals in the water. A couple of products I like for when we've gotten too much sun and we need to soothe the skin. Young Living's Lavaderm spray. There's lots of different options on the market. This is just one I personally used. BioCool is an amazing product. I never go anywhere without it if I'm going to be in the sun. You do need to be careful though, because it does have lidocaine in it. It is sold over the counter. You can get it at a drugstore or Amazon. Just make sure that you're being very careful where you put this. You don't want to put it near your neck or on your heart or things like that, because it does have lidocaine. It is numbing, and that's the nurse in me. I don't want anyone to have overexposure to lidocaine. So you want to be very careful. You can't slather yourself in this like you would your banana boat aloe vera gel. But this is the other common one. Again, you can get any brand. There's probably cleaner brands out there than banana boat. But this is the classic one you're going to see this summer. I'm sure we all have it. I have it at my house. And then lavender, again, it doesn't have to be Young Living brand, but you want to make sure that it's medical grade and that doesn't have extra chemicals in it, because that can burn your skin worse. So it needs to be medical grade. But those are the ones I personally use. Slumbra is the clothing company. Coolie Bar is another clothing company that you can use. They have actually built in technology to protect against UV light, and so that's really important. This is the one that our dermatologist recommends if you have a huge risk factor for skin cancer, and you see how wide brimmed that hat is, so it's giving her more coverage. So that's something to consider. Also, the fans that go around your neck can help with your heating and cooling, your heat exhaustion, heat stroke, and then also these little packs here that go around your neck. So another great way to stay cool. This is our social media. So we'd love for you to connect with us there on our website, Facebook, Instagram, and our blog. Miranda, Ashley, and Carolyn do a phenomenal job of keeping great resources out there on those media channels for y'all. And I would love to take any questions if you have them. Thank y'all so much for being here, and appreciate your engagement and understanding.